This is a podcast from the Nuffield Department of Medicine. Today, we've asked Dr. Luzheng Xue to tell us about his research on inflammation in disease. Hi, Luzheng. So, what are inflammatory diseases?
To answer this question, we have to start from inflammation. So, inflammation is the body's normal immune response to something we believe is harmful. But sometimes the immune system will malfunction to attack some harmless substance such as pollen, peanuts, will cause the allergic inflammation. And also if they attack, own bodies, own tissue cells, will cause autoimmune disease. So these abnormal reactions and subsequent, the symptoms, we call it inflammatory disease.
I see. So what is the specific focus of your own work then?
Yeah. Actually, we try to develop new drugs and a new method to treat this inflammatory disease. For example, we collaboration with a pharmaceutical company called Therapeutics. We try to target to asthma and atopic dermatitis. We're also working together with OCA pharmaceuticals, try to target to the autoimmune disease. So basically we try to screen the new drugs and then to work out how this drug working and how to best use them.
I see. Can you give us an example of how your work is beginning to make a change to how patients are treated?
For example, currently we working on a new drug. This drug is already in the late stage of the clinical trial. So in the clinical trial, they already show some, the benefit for the treatment of asthma.
I see.
We also found some new drugs, collaboration with OCA pharmaceutical, and this drug will be potentially can use it to treat the autoimmune disease.
What are the most important lines of research that have developed in the field over the past 5 to 10 years?
The most important research line developed in our group in recent years, we try to understand the role of the prostaglandin receptor. This receptor actually is present in some immune cell surface and then involved in the allergic response. So we can try to find a mechanism and then to develop this will potentially is a very promising drug target. We also try to working on another receptor that's located in the cell nucleus that will control some immune cell development, also leading to the autoimmune disease. So potentially also a good drug target.
Why does this line of work matter? Why should we put money into it?
Something like asthma, psoriasis, it's very difficult to treat. And they actually not poorly respond to current therapies. And if some therapy working like steroids, they will have a side effect. So this kind of a situation will be significantly reduce the life quality of the patients. And also there are heavy burden of the NHS resources. So our study will try to develop a new drug or new treatment for control this disease. So there will be benefit for these patients and improve this NHS service. So that will be very useful in the future.
How does your work fit into translational medicine within the department?
Our research allows us to understand the mechanism of the inflammatory disease, and also that will be therefore can help us to develop a new treatment, new drugs to treat this disease, and there will be benefit to the patients. Therefore, this study will directly leading to the medical applications. That's exactly what translation medicine need to do. basically.
That's great. Thank you so much, Luzheng. That was very interesting.